breast cancer rehabilitation. This week let's talk about pain in the shoulder. Now, we already know from the research that about 50% of women, many years, and what they've done is looked at 6 years down the track, which is after surgery, have got a significant dysfunction of their shoulder, which is pain or weakness. So what I'll do is I'll present a case so that it gives us an idea what might be going on, and more importantly, how to best manage this so we don't allow it to be a chronic problem. So this lady was referred from her breast cancer specialist, and she was really not sure why she was coming because she had already been detected as having mild lymphedema and was seeing a lymphedema therapist. And she had a mastectomy. So for this lady, she was 3 years after her mastectomy. Now, what we actually found was that she had more than lymphedema. She had other experiences that really she didn't normally talk about to people. So every day she would take her bra off and her chest would go into spasm. Now, she thought that this was normal and that she would have to live with this. The other symptom that she had was that when she would carry her groceries, she would experience a burning pain down the arm. When I had a look at her movement, she had full movement, so that was full arm up. But when we actually looked at what was moving, so I put my hand on her chest, there was a discrepancy in the amount of movement that was happening at the skin and at the fascia and at the rib cage. And so what I'll do is I'll show you how easy this is to miss, but how important it is to assess and treat. So this is the case, and what you'll see first is our test of the very surface skin and fascia, and so how stretchy it is, and you'll see that the hand is moving. When we look at pressing in deeper, there was no movement. And so our treatment focused on this. And so over a 2-week period, the lady used her treatment technique that she'd learned. And she came back and she was delighted in reporting that she no longer had the tightness in her chest, the cramping, the spasming in her chest, and that she also had not experienced the burning pain down her arm after carrying groceries. So this is a clue for women about what may or may not be occurring for you. So you may have what you think is good movement. And if you use a fascia test that is, it can be surface or it can be deep, then it may be that's where you'll be able to find the problem. If you think that you need some help on your shoulder, if you're experiencing burning pain or cramping pain, then I would suggest go see your rehabilitation therapist at the breast clinic, because it's really important for us to change this figure of 50% of women experiencing chronic shoulder pain or dysfunction. So let's talk more about breast cancer rehabilitation. Let's talk about the real issues that women are facing, and talk more about the rehabilitation options that are available to women. Together, we can really make a difference on this.